Good afternoon, everyone. Good day, good morning. I am Pamela M. Quesedo, and today we'll be studying group family and couples therapy. Let us have a brief historical perspective about group therapy. So, for many years, group therapy was practiced as a method of choice by only a handful of dedicated therapists. So, yung iba, ginagamit lang yung, before, mostly talaga ginagamit lang yung group therapy when the caseload was so heavy for them na kailangan group therapy na yung gagamitin so they can deal with the overload. But still, other therapists use group therapy as a supplementary technique. So, instead of being seen as second choice or supplementary form of treatment yung group therapy, yung group methods, ngayon it is now achieved as considerably more visibility and respectability. So, one of the earliest formal uses of group method was Joseph H. Pratt's work with tubercular patients in 1905. So ito yung inspirational na approach niya that used lectures at group discussion to help lift the spirits of depressed patients and promote their cooperation with the medical regimen. So a major figure in the group movement was G.L. Moreno, who began to develop some group methods in Vienna in the early 1900s, and in 1925, na siya din yung nag-introduce ng psychodrama sa United States. So, si Moreno yung gumamit talaga ng term na group therapy. So, Slavson encouraged adolescent patients to work through their problems with controlled play. Si Slavson yon, at yung procedures niya were also based in psychoanalytic concepts. So these and other figures have been identified na mga pioneers sa group movement. Yung group therapy, it was true for clinical psychology generally na ito yung aftermath ng World War II. So, as we have observed before, the large number of veterans sharply increased the demand for counseling and therapy. So, the limitation of the existing agency at yung mga hospital facilities na kinakailangan na talaga nilang gumamit ng group methods para mabigyan yung mga immediate demand ng maraming tao. So, there are group therapies based on analytic principles, may iba rin na gestalt therapy principles, behavior therapy, and many other types as well. So, let's go with approaches to group therapy. So, iba't iba yung mga approaches sa group therapy. At dahil mayroon din silang mga different na theoretical origins. And the descriptions of group therapy are couched in a variety of theoretical language. So, isa na pag-uusapan natin na approaches sa group therapy is psychoanalytic. So, sa psychoanalytic, much of the work in group therapy talaga began from psychoanalytic tradition. So, most forms sa mga psychoanalytic group therapy ay basically nanggaling talaga siya sa psychoanalytic therapy na sa group setting. So, the focus of psychoanalytic is still on phenomena such as free association, parang sa individual psychotherapy lang siya, transference, interpretation of resistance, and working through. So, ang kaiba niya lang is nasa group siya. So, may mga kasama na siya. And then the group, yung grupo becomes vehicle through which the individual can express and eventually understand the operation of unconscious forces and defenses and thereby reach a higher level of adjustment. So, in general, ang approach na to sa group therapy ay kinoconsider siya na non-directive, and group processes may transpire with only subtle input from the therapist. So, yung contrast niya lang sa individual psychotherapy, yung group therapy sa under psychoanalytic can permit a deeper analytic experience, no? Kasi yung individual, parang maglilin siya sa grupo niya na nag-i-increase ng kanyang anxiety tolerance. So, in addition, yung mga group members din na nagre-react sa each to one another, to the therapist, and to the relationships of authority and intimacy. So, habang ino-observe ng iba sa grupo yung isang member nila na nagko-communicate with one another by participating in a situation in which individual is not the sole object of the therapist's attention, and by both receiving help from others, giving help to them, the individual can achieve an analysis that is more effective than it might be in the individual therapy setting. Kasi sa grupo, you can give help and you can receive help. So, mayroon mga different approaches sa sa group therapy. Iba't iba yan sila, no? And yun na nga, yung na-discuss natin kanina. And mostly sa group therapy, no, nagko-consist sila ng 8 to 10 members, no? 8 to 10 members, equal numbers of men and women. Kung 5 yung girls, 5 din yung babae, no? Who meet for 90 minutes 3 times a week. So sometimes yung grupo naman nagkikita sila once or twice a week na wala yung therapist na mag-facilitate sa kanila the working of transference relationships. So patients often free associate their feelings about other members, no? Sinishare nila kung ano yung mga napanaginip pa nila and analyze resistance and transference feelings toward both the therapist and other group members, no? Yun siya. So, ano naman yung psychodrama? So, yung another na naman na approach na involved sa group therapy is yung psychodrama. So from the word of drama itself, no, it is a form of role playing na it was developed by Moreno 1946 to 1959. So yung patient, no, nag-a-act siya ng isang roles much as if they were in a play. So this acting is said to bring about a degree of emotional relief and spontaneity that heightens insight and self-understanding. So, patients may be asked to play themselves or another role. At times, they may be asked to switch roles in the midst of dramatization. So, the drama may involve an event from the patient's past or the upcoming event toward which the patients look with trepidation. So, yun siya, no? It might be yung drama na ibibigay sa kanilang therapist is yung situation na na-experience na before or yung ina-anticipate na mangyari. So, yun siya. Minsan din, no, nag-switch roles sila na siya na naman yung siya na naman yung parang bida, ganon. So, nag-switch roles sila. So, in general, yung psychodrama involves a patient, a stage on which the drama is played, a director or a therapist, and auxiliary egos. Yung auxiliary egos, yung mga other patients na therapeutic aids and iba pa, at yung audience. So, yung director, siya yung nag-assign ng role sa patient, and the supporting cast is made up of auxiliary egos. So, the audience can provide acceptance and understanding and may even participate contemporaneously. Next is the transactional analysis. So, ano naman ito siya, no? Si Eric Berne, 1961, was the developer of and the dynamic force behind the transactional analysis. So, yung TA or transactional analysis, ito yung process in which the interactions among the various aspects of the people in the group are analyzed. So, ina-analyze sila. So, analysis, na-focus sila sa three chief na ego states, no? Sa bawat individual. So, ano yung tatlong ego states? So, ito yun siya. Child ego state, parent ego state, and the adult ego state. So, yung each state, yung tatlong states, mayroon siyang positive and negative features. So, pag sinabing positive child, so, spontaneous siya, uninhibited, and very creative. Habang yung negative child naman, matatakotin, overly emotional, and or full of guilt. So, yung positive side naman ng parent state is supportive, loving, and understanding. Yung the negative parent is punishing and quick to condemn. The adult ego state is less oriented toward feelings and emotions, is more involved with logic, planning, or information gathering. But the adult can be reasonable, which is the positive side, or non-spontaneous, the negative side. So, depende kung paano yung tao is being raised, he or she will manifest various aspects of this positive and negative characteristics. So, yung child who was over-supervised or over-regulated by the parents might develop an inhibited or guilt-ridden ego state. So, as a result, if a person in a TE group setting discusses sex in pompous, authoritative way and the inhibited person is then asked to respond, she or may he be unable to do so or may respond under great tension. So, yung therapist din agad mag-point out siya how each person is playing negative roles. So, may tao din mag-prepare na negative parent role by being pompous and authoritative. May other person din naman na responding in negative child fashion, no? May repeated analysis of the interactions among groups reveal the ego states that they typically employ. Transactional analysis involves determination kung anong ego states ba yung operative in a given transaction between people. So, games. Ano naman tong games, no? Behaviors that people frequently use to avoid getting too close to other people. So, some games are orderly transactions that contain ulterior motives. So, sa TE group therapy, sa TE group therapy yung games, no? It is much effort is devoted na ma-discover at manalize kung paano yung mga members play games with one another. So, yun siya. The members play tend to cover the real feelings and beliefs. So, ini-observe sila dito. Next is the Gestalt groups. So, Gestalt group therapy, it is difficult din daw to categorize. Pero, same sa psychoanalytic group therapy, it is oriented toward the feelings the experience of the individual patient. At the same time, ini-emphasize nito, emphasis on resident seminars, mga weekend retreats, mga brief workshops, at mga general popularization give its distinct flavor or the encounter movement. So, yung Gestalt therapy, no, as we have learned in chapter 13, it focuses on leading the patient to an awareness of the now, kung ano yung present na pangyayari, and appreciation of one's being in the world. So, in group therapy, this is achieved by concentrating on one member at a time. No? Isang member lang at a time. The therapist focuses on the patient while the other group members serve as observers. No? Isa lang yung finofocusan ng therapist habang yung iba nag-o-observe lang sila. So this has been dubbed the hot seat approach. Patients are asked to experience their feelings and behaviors, to lose their minds and find their senses. So, other members of the group are not just passive observers. They may be called on to say how they regard the person in the hot seat. So, may mga role playing din, no? Sa Gestalt group therapy, reporting of dreams and dialogue between patients. So, yun siya. Behavior therapy group. So, group behavior therapy, it is fairly popular mode of group therapy in contemporary clinical psychology, and it seems to have grown out of considerations of efficiency rather than a primary decision to focus on the dynamics. So, It is entirely feasible to conduct desensitization sessions, model interpersonal skills, or use cognitive restructuring intervention in a group setting. So, for example, it is possible daw na magturo ka sa patients in a group setting how to relax. And it is equally possible to establish common anxiety hierarchies simultaneously with several patients. Where such procedures are feasible, it is certainly efficient to use them. So in contrast to other group therapy approaches, the therapist in group behavior therapy often plays a very active, almost didactic role, providing lessons, skills training, and homework assignments. So, yung ibang mga approaches no sa therapy, 'di ba? Yung iba na pwede silang mag-meet by group na kahit wala yung therapist, but sa behavior therapy mas active, mas involved yung therapist. So nagbibigay siya ng mga lessons, nagbibigay siya ng skills training, mga homework assignments. So behavioral and cognitive behavioral groups are usually time limit. So, example given, 12 sessions lang sila. And are comprised of patients na pare-pareho lang yung mga problems. For example, yung mga trauma or mga anxiety. So, ganun yun sila. So, these group members complete a number of assessment instruments before, during, and after treatment para ma-monitor yung mga progress nila. So, it provides number of examples of how reinforcement, modeling, problem solving, and cognitive interventions are implemented in behavior therapy groups. So meetings take place on a weekly basis for a predetermined number of sessions. So yung arrangements nila na because of the wide variety of group approaches used by clinicians, no, it may be somewhat misleading to give a general descriptions of the arrangements for group therapy kasi 'di ba iba-iba yung mga mga applications nila, iba-iba. So, iba-iba din yung paano sila mag-arrange sa grupo nila. Pero, despite sa magkaibang mga techniques nila, may maroon naman silang general similarity. So, for examples, most group consist of 5 to 10 patients, no, who meet with a therapist at least once a week for 90-minute to 2-hour sessions. The members are often seated na circle form para mas makita nila yung isa't isa. And sometimes then they are seated around the table or sometimes na walang table. So the composition of the group may vary depending both on the therapist's convictions and on practical considerations. So may mga therapists na they feel strongly na yung heterogeneous group or yung iba-ibang klase ng yung mga iba't ibang klaseng members yung pinapasa nila sa group is best one daw that includes women and men with variety of problems, iba't iba yung mga backgrounds at iba-iba yung personalities. May mga other therapists din na feel nila na homogeneous groups yung best, na groups na composed na similar lang yung problems nila or similar lang yung personality nila. So, for example, no, groups may composed for yung exclusive lang sa mga alcoholics, no, or patients na with phobias. So, depende yun siya sa therapist. So kahit ano man yung pagkakaiba nila, no, they lahat talaga generally they have these issues of confidentiality na ina-announce sa grupo na kung sa atin pa, no, what we see, what we hear when we leave it here. So, ganun yun siya. So, let's go with the curative factors. So, The diversity of group approaches is apparent, yet underlying all of them are common threads that speak to the utility of group therapy. So si Yalom noong 1975 may specified siya ng set of curative factors that seems to define the essence of what these group methods offer. Kung ano yung ino-offer ng group na to. So number 1 is imparting information. As you can see on the screen, no? Group members na nakaka-receive sila ng advice at guidance, hindi lang galing sa therapist nila, kundi pati rin sa mga members nila. Number 2, instilling hope, no? Inoobserbahan nila yung ibang member nila na naging successful sa pag-overcome ng problem nila na nagbibigay din ng hope sa kanila. So hope, it is a necessary ingredient for any successful therapy experience. So number 3 is universality. No, listening to others. One discovers that he or she has the same problems, no? Parehas sila ng fears and parehas sila ng concerns. So, knowing that, it means you are not alone and it can be highly rewarding and comforting, di ba? Knowing na you are not alone pala na naka-experience ng ganito. Next is altruism. So, in the beginning, a group member often feels useless and demoralized. So, as it becomes apparent that one can help others in a group, a feeling of greater self-value and competence emerges. So, next is interpersonal learning. Of course, kasi nakikipag-interact ka, no, with other peoples within the group. So, next is imitative behavior. So, watching and listening others, no, nagiging model mo sila. Kung yung mga useful behaviors nila, nagiging model mo sila. So, group members can learn from one another. Number 7, corrective recapitulation of the primary family. So, the group context can help clients understand and resolve problems related to family members. So, yung mga epekto ng mga past family experiences can be dissolved by learning that maladaptive coping methods will not work in the present group situation. Next is catharsis. So, learning kung paano mo i-express yung feelings mo sa iba, na yung pagiging honest and open way builds a capacity na mayroong mga mutual trust na at understanding sa bawat isa sa grupo. So, number 9 is group cohesiveness. So, group members become tightly knit little group that enhances self-esteem through group acceptance. So, yun siya. So, next is we'll proceed with the family therapy. So, generally, no, when a member of family develops a problem, everyone in the family is affected, right? No? It increasingly, no, families are going into therapy as units in attempt to fathom the nature of difficulties and that means by which to deal with them. So, family therapy, it is indicated by the numerous handbooks and overviews of the field that appear every year. So further evidence of this interest is the special sections on the treatments of the families that appear frequently sa journals such as Journal of Consulting and Clinical Psychology. So, it is important to note as well na yung family therapy, it differs somewhat from simply involving family members in treatment. Indeed, it is quite common to involve parents in the treatment of the youth, no? For example, no, may problem ang isang bata, it might be na yung parents niya ay involved, no? May involved din sa treatment plan, no? Example, as siblings, no? Additional support from the members in the treatment of patients or more generally. So, yung development ng family therapy, so, Spritzky and Jacobson, 1991, traced the origins of family therapy to the 19th century social work movement. Some of the delay had to do with the long-standing dominance of psychoanalysis. Kasi, di ba, no? Psychoanalysis talaga, yun yung mas dominant, no? The perspectives of behaviorisms and humanisms paved the way for an alternative treatment like family therapy to become a viable option for clinicians. So, in trying to understand schizophrenia, no, for example, no, a Palo Alto research group approached the problem from a communication point of view. No? To influence a family member, one must deal with the entire family system. Ito yung ginamit nila para mas maintindihan nila yung schizophrenia na disorder, no? Related to the idea of the family as a unit is the concept of double bind. So for example, no, yung bata may be told by a father na always stands up for your rights no matter who, no matter what, no. Example, no, sabi ng papa na, kung tama ka, no, magsalita ka, kung tama ka, kung feeling mo tama ka, no, then be strong, be brave and stand. Pero at the same time, yung papa din yung nagsasabi na wag mong questionin yung otoridad ko, I am your father, at kung ano yung sasabihin ko, yun yung dapat gagawin mo. You see the opposition between those lines, right? So, the contradiction inherent in the two messages ensures that no matter mai-entail sa isip ng bata na kahit pala anong gawin ko, no, I may remain, I may shut down or mag-speak out, I am still wrong sa mata ng papa ko. So, here in schizophrenia, no, they were trying to understand schizophrenia through the family system and by focusing ng communication within the family. So, observation of schizophrenic patients who live together with their parents in hospital ward for sustained periods lead to the conclusion that the entire family unit was pathogenic, not just the patient. So, by that, no, malalaman na hindi lang pala yung anak na may schizophrenia yung problema, but the whole family or the other members within the family. So that is how important the family therapy is. So the concept of communication, kasi di ba we've mentioned earlier about communication na emphasize sa schizophrenia during the family therapy. Okay, so family therapy deals with the relationship between the individual family member and the family system. So, di ba yung family, may system sila eh. Parang may values sila na sinusunod. May mga system silang sinusunod which family therapy seeks to alter in some important way. So, many conceptualize the family is constantly striving to maintain homeostasis. So, sometimes the family successfully adapts to a particular pattern of interaction within the system. However, kung yung system mag-change, for example, yung anak is naging older na and is no longer experiencing significant delays, then the system is unable to adjust to a new homeostasis. So, general system theory would suggest that this unbalanced state is the focus for family therapy. The therapist achieves positive change by using feedbacks that alter the way system functions and reestablishing a new healthy homeostasis. So, ano naman yung forms and methods niya? So, wala talagang klaro at consensual definition of what constitutes family therapy. So, the general procedures of family therapy are carried on by psychologists, psychiatrists, pwede rin ng mga social workers, counselors, at iba pa. Family therapists at mga counselors are trained in several different programs, including clinical psychology, counseling psychology, psychiatry, social work, family and child development, and education. So, all of this, of course, makes for considerable confusion and some squabbling over professional credentials, no? Thus, no, we have family therapy, behavioral family therapy, conjoint family therapy, concurrent family therapy, collaborative, network family therapy, structural, and multiple family therapy, and so on. No? Iba't iba yung tawag. So, ano naman yung goals ng family therapy? So, yung although no, may iba't ibang tawag, may iba't ibang mga professionals yung gumagamit ng family therapy, no? They have this primary goal of improving, number one is communication talaga within the family, and they emphasize the problems of the individual in favor of treating the problems of the family as a whole. So, for example, many therapists who talk about the family system still seem to view family therapy as a sign of context in which to solve an individual problem. So, seeing the family together becomes a technique for inducing changes in the individual patient. So, may ibang therapists din na devoted to the philosophy that regarding the family as a unit and working with it, such will enhance that unit. So, iba't iba yung mga perspectives, yung way ng mga professionals, but they have this goal na to help and to improve especially the communication within the family. So, ano naman yung conjoint family therapy? So, the entire family is seen at the same time by one therapist. Ito siya, no? Yung entire family, minimit siya same time ng isa lang therapist. So, in some varieties of this approach, the therapist plays a rather passive or non-directive role. In other varieties, the therapist is an active force, directing the conversation, assigning tasks, nagbibigay silang tasks sa lahat ng mga family members, and imparting direct instruction regarding human relations and so on. May mga 5 basic modes of communication sa conjoint family therapy by Satir 1975. Number 1 is placiting. Ito yung always ka nag-a-agree no matter what is going on. Ito yung na-observe na 5 basic modes ng communication sa pamilya. Pangalawa is yung blaming. Yung may tao na always niyang biniblame or kinikriticize niya yung isang member nila. Next is super reasonable, no? Especially characteristics of teachers whose words may come out super reasonable but may bear no relationship to how they feel. No, yung parang best in parang sad pa nila, best talaga siya na mag-explain rationable kahit wala yung mga sinasabi niya, kahit opposite sa kung ano yung nararamdaman niya or wala talagang relationship kung ano talaga yung truly na nararamdaman niya. So next is irrelevant, no? The words are completely unrelated to what is going on. Next is congruent. The words relate to what is real. So these modes of communication provide in a sense that the essence of communication and feeling. Other varieties of family therapy, no? Concurrent family, one therapist sees all. Collaborative family therapy, each family member sees a different therapist, no? Sa behavioral approaches to family therapy, therapists generate a behavioral analysis of family behavior. Next is multi-systematic therapy developed for juvenile offenders and their families. So, yan yun siya. So, ano naman yung multi-systemic therapy? It is a more recent mode of family therapy. It was developed as an intervention for juvenile offenders and their families. Yun nga yung sinabi ko. So, when naman natin makandak yung family therapy, no? Wala talagang mahirap at at mabilis na rules kung ano yung appropriate at ano naman yung hindi appropriate. So most often, family therapy is begun with an adolescent as the principal patient. So, family crisis such as namatayan sila, propel the entire family unit into one pathology almost as one. So, may mga conflict over values, marital or sexual problems. So, yan yung na-apply agad yung family therapy. So, lastly is couples therapy. So, ano man yung couples therapy? So, please do note that couples therapy is not limited para lamang sa mga married couples, but it can be provided to unmarried couples, to same-sex couples, and others. So, there are many issues that bring couples in to consult with a clinician. So, di ba, may mga couples na they have a problem with one another. So, yun sila, lumalapit sila sa psychologist for the couples therapy. So, for example, when a husband and wife are seen together and the focus of treatment is on the marital relationship rather than on the problems of individuals, a form of family therapy seems to be involved. So, for example, may problema yung husband and wife. So, yung treatment talaga nila is on marital relationship. So today, the most popular forms of couples therapy are behavioral marital therapy, cognitive couples therapy, emotionally focused couples therapy, sex therapy, and insight-oriented couples therapy. So next is we'll have this behavioral marital therapy. So it is often traced to the work of Richard Stewart, no? BMT does not require that the partners be married. Stewart's treatment of marital dysfunction involves the application of reinforcement principles to couples interaction. No? A major component of his treatment was a technique called contingency contracting. Ano ito siya? As spouses were trained to modify their own behavior to effect a specific desired change in their mate's behavior. Chini-change nila yung own behavior nila. So, support understanding technique aim to increase a positive behaviors emitted by partner, increase collaboration within the couple, and increase positive feelings in each other. So, for example, each partner nag-generate sila ng list of behaviors na gusto nila. For example, the wife would make a list that I hope that my husband would buy me chocolate. I hope that my husband would bring my bag when we're walking along the road. Ganon. And then yung husband din naman, nag-list din siya kung ano yung mga gusto niya. I hope that my wife will not just cook food for me, but will eat meal together with me, ganon yun sila. Then next, pinag-uusapan ng couple na they will look at each other's list and they would agree to do or to perform those list, para sa next sessions, doon na sila reflect or feedback sa therapist nila. Ganon yun siya. So, problem-solving techniques, it involved training couples in positive communication skills so that effective decision-making and negotiating are possible. So, for examples, yung couples, binibigyan sila ng mga basic rules kung paano makig-communicate sa bawat isa in a positive way at pinapractice yung mga positive communication skills sa sessions nila. And the clinician intervenes if she or she thinks it will be helpful, Example given, clarifying the appropriate communication skills, modeling alternative ways to communicate. So, ano naman yung emotionally focused couple therapy? So, emotionally focused No? It is a brief treatment that seeks to change partners' problematic interactional styles and emotional responses so that a stronger and more secure emotional bond can establish. This treatment approach assumes that negative effect and associated destructive interactional styles create marital distress. So, I mean, ano, from the title itself, emotionally focused, no? Couples treatment. So, yun lang yun siya, no? Group behavioral family and couples therapy. So, I hope na marami kayong natutunan and thank you so much for listening. God bless.